According to a recent study, up to 1 million Filipinos may be suffering from Hepa C, that many more are still at risk. The viral infection, which is contracted by sharing needles and having unprotected sexual intercourse, does not typically show symptoms, so many remain unaware of its dangers. Now, this morning we get to know more about this disease, and we have here today with us Dr. Ira Yu of the Hepatology Society of the Philippines. Hi, good morning, Dr. So maybe, Dr., you can give us a one-on-one on Hepa C. What is hepatitis C?
Okay, hepatitis C is actually a viral disease. This is specifically caused by a virus, which we know hepatitis C virus. Although it can affect any organs of the body, it primarily targets the liver. So consequently, if you don't get treated, if you don't get diagnosed, you end up with liver complications like liver cirrhosis, liver failure, or even liver malignancy.
So, Doctor, is there a specific group, age group, or a specific sector which targets Hepa C?
Unfortunately, no. It can target even the babies. Okay, if they get born to an infected mother, it can target children. Okay, it can target the teenagers, even the adult. Okay, so really, no specific age group.
So, Doctor, how does one get Hepa C?
Okay, hepatitis C is transmitted only through blood and sexual contact with a Hep C infected individual. So they are basically at-risk groups, those with frequent tattoos or body piercing. Unfortunately, for patients who are on hemodialysis, because hemodialysis is actually one means of transmitting the virus to individuals. Patients who are sexually promiscuous, okay, those who have unprotected sexual intercourse, those who have injected, okay, IV.
So, Doctor, if I'm not mistaken, the society, the group, no, Hepatology Philippine Society. What is this, Doctor? I mean, do we want to? Is it more of a campaign awareness regarding this kind of disease, and for the public to know more about it?
Okay, actually, right now, the society, not only the Hepatology Society of the Philippines, but also the Philippine Society of Gastroenterology, we are very active in promoting awareness, not only among the hepatitis C infected individuals, but also among the Filipino citizenship as a whole. And we are partnering with some private sectors, particularly pharmaceutical companies, so that we could reach out to more people. Okay, you know, the dictum here is to educate people more, because if they don't know the disease, then how can we actually help them? So we have to start from somewhere, and that is basically through raising awareness.
And Doctora, how is that? Are the numbers dropping? Are the numbers increasing? Give us an overview of the situation of this disease here in the country.
Right now, the prevalence rate has remained stable. It's still 1%. It's actually much lower compared to hepatitis B, which is around 16 to 18%. But that 1%, as I've mentioned earlier, is still a big number, because if you translate it to the number of Filipinos affected, it's still 1 million. And 1 million is not a small number to just disregard, okay? Has it been dwindling? I don't know, maybe just stable. But we're lucky now because we have effective treatment that we can offer to them.
And speaking of Doctora, no, I mean, you were explaining to us that at some point, people who have Hepa C find out that they do have Hepa C at the last stages already, because there are no symptoms. So what is your advice, Doctora? How do we know, should I have myself tested for Hepa C? Who are the people who should be testing for this? And what are the symptoms, if there are?
Okay, early on, really there are no symptoms. So the problem is that patients don't come to you because they feel something bad, okay? Most of them, okay, would just end up with flu-like symptoms, a little bit of tiredness. They thought it's nothing, okay? So those who usually come to us are the jaundice patients, those with ascites, those with liver failure, and sometimes it's so difficult to treat, okay? So the problem right now is really to identify the patients who are on the early stage of the disease. Okay, so what we advocate is for patients who are on the high-risk group. Okay, so what are these? Again, okay, those who have frequent unprotected sexual intercourse, those who are IV drug users, okay. CKD patients on regular dialysis, they have to stick, okay, strictly to protocol, like every 3 to 6 months monitoring. If you are involved in a high-risk profession like nurses, dentists, medtech, okay, or those in the medical field, because we are constantly exposed to body fluids, okay, or blood, okay, then there should be regular screening. Okay.
Doctor, you did mention that there are stages when it comes to Hepa C. You mentioned acute hepatitis C and chronic hepatitis C. So are they curable, or is it something that you have to live with for the rest of your life?
Okay, when a person gets infected, okay, we call it acute infection. Normally, the body's own defense system will try to fight off that infection. And that fighting normally occurs within 3 to 6 months of the infection. However, the problem with Hep C is that majority cannot fight off spontaneously the infection. In fact, 80 to 90% of those infected end up with the virus for the rest of their life. So they become chronic carriers. Okay?
And when you say chronic carriers, Doctor, that means?
That means that the liver is gradually being attacked, okay, by the virus until such a time, like after 10 to 20 years of untreated infection, you end up now with liver cirrhosis and much worse, a liver malignancy.
And when one has Hepa C, is it there for the rest of their lives?
Yes, okay, unless you treat, okay. Medications right now are very, very good, okay.
So, Doctor, it's more of a disease that you have to live with once you have it. You just have to manage it. It's not curable, but manageable.
Okay,
correct?
right now it is curable.
Okay.
We have very good drugs right now, very affordable drugs that can treat it with just 3 months of treatment.
Doctor, what is one of the reasons that you see why the country lacks awareness when it comes to hepatitis C?
Well, sadly, because as a nation, we are not really health conscious, okay? Unlike the other countries, they go to the physicians, even if they don't feel something bad, they just go there for an executive checkup. Sadly, that is not true in the Philippines. So I hope really in the next few years, we get to switch from that culture of unawareness to a culture of health consciousness.
Well, on that note, thank you very much, Doctor. I think it would be good to actually shed a light on this disease, hepatitis C, and not only just provide information, but also to make people more aware of what this can do to us in the long run. So thank you very much for that, Doctora.
Okay, thank you.